Okay, so I'm a spine surgeon working at Sahlgrenska Göteborg. And this is our disclosures. And so what I'm going to talk about today is cervical foraminal stenosis in combination with MRI diagnostics. So the standard procedure for an MRI is having the patient in a relaxed supine position going into the MRI gantry. And when we see the patients, sometimes the clinic is not really clear and the imaging might not give us a clear diagnosis either. And in the clinic, we then use sometimes the Sperling test. And our idea was, what if we could do the Sperling test inside the MRI gantry and then do a new image acquisition? So to do this, we built this prototype that can control the head and neck via hydraulics from the control room, so we can pretty much simulate a Sperling test. So in this study, we wanted to test, can this Dimerix do a simulated Sperling test? And do the patients tolerate lying in the camera in this position? And do we get images that are good enough to use in the clinic? And of course, do we see any foraminal changes after we add this provocation? So we added or included 10 patients with intermittent arm radiculopathy with a positive Sperling test with 1 or 2 ipsilateral foraminal stenosis on the referred MRI. So we used the 3 Tesla MRI. We took an image acquisition in a regular relaxed position, and then we applied the simulated Sperling test, and then we did a new image acquisition. So we looked at C4 to C7 on the symptomatic side. We measured the foraminal area and the cross distance on the axial image plane. Also, we used classification systems, the Park systems on the oblique side, and the Kim system on the axial image plane. And the results. So all the patients, they could perform the scans in both the relaxed and the Sperling position. And we got images of sufficient quality in 9 out of 10 cases. And this is an example of one patient. This is the same image. The lower one is just to show how we measured the area. And then this is the same patient, but now in the Sperling position. And in this patient, we see it's obvious that we got a change in the foraminal area and size. After adding the Sperling position, they got an increased neck pain and arm pain. And in 9 out of these 10 patients, they recognized this concordant pain. So here I want to show the area changes. So on the y-axis, we have the area changed, and here's the 0 line, meaning that every dot above is an increase of area, and everything below is a decrease. And then on the x-axis, we have the Park grading. And now I add the foramens that were not suspected stenotic. So they're skewed to the left, which is expected because they have a lower Park grading. And they went both ways, both larger and smaller areas. And then we add the suspected on the initial referred MRI, and we see that they have higher Park gradings. And we can also see that they are closer to the 0 line, meaning they're less dynamic. And then I'm adding when we classified them after the Sperling test. And what happens is 13 of the 30 changed classification, and 12 of these went to a higher classification, and 1 went to a lower. And then the same thing on the axial image plane. I'm just putting in the non-suspected. I'm going to be clear here. Here's the 0 line. This is distance change. So this is a longer distance, a shorter distance. And then we add the suspected ones, and they're skewed to the right, which is expected. And they are less dynamic here as well. And when we classify them, we see that when adding the Sperling test to these patients, the classification significantly changes. and all that were suspected in the beginning, they were pushed up. So every one of the suspected ones is now in the KIM class 2 classification group. So we conclude that the DIMRICS can simulate a Sperling test, and that the patients tolerated this procedure. We got images of sufficient quality, and we found this significant changes of the classifications. So a little peek to the next study. We also took this bony MRI images, and we put them into a Sectra CTMA software to overlay them so we could very distinctly see what really happened. But that's another talk. Thank you so much.